So this is, as I explained, left revision stapedotomy with an extrusion of the previous TORP, which was inserted from Malleus to stapedotomy. So this is what we have is the left ear. So this is 12 o'clock, 3 o'clock, 6 o'clock. We can see the elbow window here. I already removed the previous TORP, which was extruded, and you have the promontory here, the round window niche. Of course, we can see this eroded incus, but also we have an erosion of the malleus. This is the reason why there was an extrusion of the TORP. There's normal malleus handle, which is completely resorbed, and we only have some kind of residual neck of the malleus there, which cannot be used, as you can see. So I will use a Malleus Replacement Prosthesis. We're going to remove the whole block, fence. I remove Malleus Incus, and we're going to use a Malleus Replacement Prosthesis simultaneous insertion Causse Ear of a Malleus Replacement Prosthesis and Ossiculoplasty Teflon TORP. Same as the previous case. Okay, so I remove this. So I took, of course, cartilage and pericardium together. Donnez-moi le lancez-vous direct, s'il vous plaît. Claron. Okay, fine. So now first step is to place the Malleus prosthesis. Table vers moi, s'il vous plaît. Oui, allez-y. Vers moi. Stop. And we can see on the right we have some bone, of course, in the posterior superior part of the bony canal wall, which is good enough to insert the Malleus prosthesis. Here. Bon, j'ai pas besoin par contre d'aplanir là. Un petit peu, donnez-moi. I will flatten a little bit the bone, but not that much. I don't need too much here.
And they are all the same size.
These Malleus prosthesis, yes. Yeah, they're all the same size.
Tu vas brancher le bière.
Excusez-moi.
Okay. I just want to flatten a little bit to make it a little bit more flat, to make a chamber for to leave room for the attachment of the two hooks of the Malleus prosthesis. I have to turn to rotate a little bit the microscope. So you see, I can make a chamber like this with the burr. Not that much, like this will be enough, I think. A little bit more. Oh, I think it looks good now. Okay, so now we need to determine the position of the two hooks. As you remember, I have to drill out two holes through the bony canal wall, so we're going to determine that now. Inspiration encore, s'il vous plaît. Okay, good. All right. So. Okay, just now want to determine the position of the two hooks. So I will just put the Malleus prosthesis opposite in terms of position of the two hooks. Like this will be, I think, quite good. I'm going to put it a little bit closer to the ring. So I will make the first hole here. And then I will determine the second one. As you know, I'm using now 0.6 millimeter diameter diamond dust burr. I need to rotate. It's a 5.5 millimeter diameter speculum, which means it's a really narrow canal. Un peu de sérum, s'il vous plaît. Sérum. Non, encore. Sérum encore, s'il vous plaît. So I use saline solution to refresh, to help for the drilling out. Like this, you see, only at the distal tip of the burr. It's quite a strong bone, but now it's fine. And now I need to determine the position of a second one. A little bit big hole, but I don't mind. So the first one is here. So it means that the second one will be here. I'll make it closer like this. Okay. I made a change because I don't really like the one I made, so I may turn and make another one here. Yeah, I will make another one and closer here because I don't like this one. Ok, alright. Allez, on recommence avec celui-là. La fraise, s'il vous plaît. Du sérum, après, encore, comme tout à l'heure. Here will be better, I think. Okay, sérum. You know, this first hole I made is a little bit too large. Vous avez une fraise neuve là parce que.
Je vais donner une fraise aussi, neuve de la.
Donnez-la moi celle-là déjà.
Fraise neuve. Elle a changé.
Donnez-moi, ouais.
Elle va pas donner.
Ok, ok. Allez, merci. Okay, changed my burr, which was not so good. It's quite a hard bone, really hard bone. There we go, now it's fine. It's a little bit smaller than the previous one, which is going to be fine now. And now I will choose the position of the second hook. Okay. It should be we'll do it here. I'll be fine here if I put it here. So this is approximately 3 o'clock. Wait. Ok, encore du sérum. Encore. It's really step by step. You don't have to force too much. You just leave the dermatologist doing the job with saline solution. This one is really thick. Okay, continue. It needs to be transfixed, and you need to do completely through the bone like this, okay? There we go, now it's fine. Okay. Alright, so let's try now to insert this prosthesis, inserting both hooks to their corresponding holes. I need to rotate that on the other side like this. There we go. Larron. Calmez s'il vous plaît. Larron. It's resistant, so maybe I need to drill out more. Crochet s'il vous plaît. I thought I made a complete hole, but it's not transfixant. Maybe I don't know. I will see. La fraise encore s'il vous plaît. Cannez d'abord, cannez. I need to check, but I think the hole is not made completely. Yeah, there is some residual bone here. Ok, allez, la fraise encore. Sérum. Okay, now it's fine. Cannez. Alright. Larron. There will be a little bit of bony regrowth, but not that much in fact in my experience. It's strange to see that, but cannez. So I need to push it more, because it needs to be inside, definitely inside. Larron, to be flat. There we go. Okay. So now we have a new Malleus handle, as usual. Un 12, s'il vous plaît d'abord. C'est un 12? Okay. Okay, now it's fine. And you see that this Malleus prosthesis is definitely flexible. You will see that. Calmez s'il vous plaît. Because I can move it a little bit more anterior. It's over a round window niche, but I just want to place it over the oval window niche. So I will rotate it like this, okay? And now it's fine, it's over it. Of course I will change it again, but now I need to determine the position of the Malleus handle compared to the tympanic membrane, and then measuring the distance. So we know that the previous prosthesis, the previous TORP was 7 millimeters long, with a really atrophic tympanic membrane now. So this is important to reinforce that. Okay, I will first make a first measurement, but I see if I'm going to change it maybe later. Mesureur. As soon as I will have performed the fenestra, I will measure again, just to determine first step. It was 5 millimeters the previous one, and here we have 6 millimeters, okay? Because it's a 5.28 meter long measuring device. So this is the second one, which means 6, sorry. Plan. So I will cut the prosthesis at 6.5 because I need to take into account the groove. Okay, so now I will pull back the Malleus handle posterior, so then I will now refenestrate the oval window. Table vers moi. Stop. Okay. And I'm going to use a micro drill again with 0.7 millimeter burr à fraise.
I said.
Oui. Montez la table, s'il vous plaît. Stop. Très bien. Ok, alors, on y va, la fraise. J'ai un 7, hein? So I use 0.7 millimeter burr and 0.7 millimeter suction tube. So I'm drilling out through the previous interposition like this. Okay? Il marche pas l'aspi. There we go, you can see the fluid coming out. Going to enlarge it a little bit more. Okay, it's gonna be fine. We have some lymphatic membrane, but I don't need to remove it. There we go. Now the fenestra is done, okay? So I will, of course, now cover it with the vein graft, which I already took. Une torpe, hein, encore. La même que tout à l'heure. Ouais. Here is the vein, which I already took. It's a pre-shaped vein, so you can see it's totally dry. But I don't mind. Bistouri, s'il vous plaît. I remove it from the glass plate. We are facing the intima of the vein. And of course this vein graft will become wet very fast. So I need to stretch it over the oval window to close the fenestra, of course, and to protect the inner ear. L'inspiration marche pas bien. Non, ça va. Changez-moi le 9, s'il vous plaît. Non, changez pas. C'est bon, c'est bon. Changez juste le tuyau là. Okay. pas l'aspirateur. Non, elle marche pas l'aspirateur. Elle marche pas.
Change le... Là, est-ce que c'est mieux?
Ouais, je sais pas.
Allez-y. Elle marche pas du tout.
So we have a problem with the
Change
suction. We need
le
to
câblage, hein, comme on t'a
change.
dit tout à l'heure.
Non, ça marche pas. Ça marche, hein? Ah oui. Bon, c'est bon, donnez-moi. C'est un 9 hein, que vous m'avez donné là.
Ça marche, hein?
Oui, ça va. Oh, attendez, il faut que je reprenne la veine. I need to take the vein again because it's completely wet now. Calmez. So I need to stretch the vein like this and then put it again back. So if you try to put it inside it without stretching it before, it's not going to work. Okay, this is the intima again. And this is the adventitial side. I just check everything just before. Okay, now the vein is fine. I'm going to take it now with the sucker, and I will stick it to the over window. Okay. And of course I need to stretch it. I know that the fenestra is there, here. And with the TORP like this, and especially when I use Malleus prosthesis, the vein graft in this position is of major importance, because you need to avoid protrusion of the prosthesis within the labyrinth, and the vein graft will protect, of course, against that. Okay, I want to stretch it first like this. Now it's fine. Now it's fine. Okay, so now we cut the prosthesis at 6.5, 6.50 donc. There we go. We've got this prosthesis adductor head with a groove at the center of the head and 0.4 millimeter diameter Teflon shaft. So cut it at 6.5 like this, and then bring it back to the round window niche. Donnez-moi le cannelé, s'il vous plaît. So I just want to pull the Malleus handle more posterior to be able to place more easily the prosthesis, because everything is in the middle of the field in a very narrow canal. Okay, I'm going to introduce the prosthesis first like this. So I need to introduce the shaft first, I think from the other side of the Malleus prosthesis. Okay, now it's fine. It's going into the fenestra. Okay, calmez. I'm going to rotate the head like this. Causse. And what I want to do now is to place the Malleus handle within the groove. Calmez, s'il vous plaît. There we go. Okay, you see it's nice now. It's very connected together, very flexible. You see that it's holding the prosthesis in a nice way, because if you don't put anything like this, you put a TORP directly underneath the tympanic membrane, but there is nothing to hold the prosthesis. Where here now you can see it's flexible and the malleus handle is within the groove. Okay, so now what I need to do, of course, is to interpose the cartilage. The cartilage should be between the tympanic membrane and the malleus handle. Okay, so let's see what we have. I already took the cartilage before. I'm going to make it thinner because it's too thick. Sometimes I trim it, sometimes I put it on the press and break it progressively. Not too much, because if you break it, it breaks completely and then you don't have any more cartilage. I think this is nice now. Yeah, this is what we have. It's a little bit thick. Okay, bistouri, s'il vous plaît. I need to trim it a little bit. It's too big. Okay. Okay, let's see what I can do with this. Might be a little bit too large. We will see, we will decide. Ah, definitely too large. So I need to trim it. Bistouri. Vous avez une autre lame, s'il vous plaît? Ok, bon, ça va aller. Allez-y. It's really a very small canal and small area in this patient. This is why I have to trim it. Okay, let's see what we can do with this. So all I need is to cover the titanium part of the prosthesis, which means the handle, of course, but also the two hooks. So we'll slim it like this. Okay, let me see how it goes. I don't want to dislocate the prosthesis, so I need to check. It's a little bit dislocated, I think, so I need to... Yes. There we go. Now it's much better. You see, it comes back to the good position. Now I'm going to place the cartilage back and the graft and the flap. Okay, I think it's pretty good. I need to check again, so I will re-elevate the whole flap plus the cartilage, and it stays in place. You see, the TORP is in good condition. still moving well with the Malleus prosthesis, which is good. Okay, all right, it's done. So I just reposition the flap and just insert the metal cell, which, as you will be removed on the 5th day. Okay, good. Allez-y. Okay, thanks very much. I think it was quite interesting. Not frequently seen, because it all eroded the ossicular chain in this otosclerosis surgery. It's pretty rare. But there's a history of otitis, of course, in this case too. Okay.